upper extremities help us function and accomplish our day-to-day tasks. What happens when an injury occurs and your mobility is put at risk? On tonight's episode of Health Now, we'll dive deep into the field of orthopedic care and the various services that are helping patients at St. Luke's. I'm Ashley Russo, and this is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at orthopedic care offered at St. Luke's University Health Network. Stay tuned. Thanks for joining us. Our first panelist here tonight is Dr. Jeremy Raduca. As an orthopedic hand and upper extremity surgeon, Dr. Raduca treats all hand, wrist, forearm, and elbow conditions and specializes in upper extremity trauma, sports-related injuries, and arthritic conditions. Dr. Raduca also has a special interest in peripheral nerve disorders of both the upper and lower extremities, including care for amputees dealing with post-amputation pain. Welcome to the show.
Thanks for having me, Ashley. Appreciate it.
Dr. Raduca, tell me a little bit about your training as an orthopedic surgeon and that led you to this subspecialty.
So as part of orthopedic surgery, you have to rotate through all the different subspecialties of orthopedics. And to me, it became quickly apparent that hand surgery is what I love to do and wanted to do. I was lucky enough to have excellent mentors during my training at Brown and then at Duke for my hand fellowship. And those people helped guide me along the way. And the intricacies of the hand and returning function to patients, since the hand is such an important part of your body and daily activities, just really drew me to the specialty. And that's the part I enjoy most about it, just getting people back to doing what they want to do, using their hands at work and everyday life. And I think it's just a very important part of the body.
Absolutely. I mean, you notice even if you have to put a Band-Aid on one of your fingers, how it affects your day-to-day living. I can't even imagine with a massive injury or something else going on. What is it that you tell patients when you meet with them about how you can maybe help them get that mobility back?
I think it depends on what type of injury you have, whether it's an acute traumatic injury versus a more chronic, nagging, overuse type of injury. What I try to tell people is to give them all the options that they have available to them for treatment and let them choose what course of treatment they think will work best for them. Everyone's a little bit different and not every treatment is going to be right for every single patient. So giving them options I think is the best thing to do, and then help guiding them throughout the course and when to make the next step as far as how invasive the intervention should be.
Excellent. Personalized medicine at its best. Thanks for being here. Joining our panel next is Dr. Haitham Rami. Dr. Rami is an orthopedic shoulder and elbow reconstruction specialist. His goal is to help his patients return to work, sports, and the activities they love. His clinical interests include upper extremity injuries, joint replacement, trauma, and sports injuries. He has extensive experience with minimally invasive procedures and cutting-edge arthroscopic techniques. He enjoys teaching the next generation of orthopedic residents and students and lectures regularly on orthopedic-related topics. Dr. Rami, thank you for being here.
Thank you.
As an orthopedic shoulder and elbow surgeon, how did you find that specialty through your training, and what do you love most about teaching?
Sure. So along the lines of Dr. Raduca, I had great mentors through my training who exposed me early on about shoulder and elbow surgery in this specific field. There was some very interesting cases that I came across that helped patients who are at their wits' end, very complex cases that they needed help with, that they couldn't find anyone else to get that type of care for. So these specific surgeons helped them out. To get them back into their pre-injury level or their quality of life to improve it, I think that was really what got me into it, because we see that. They had no other way to go, and they came to us and my mentors, and they found an answer.
That's amazing. And what is it that you tell patients when they're coming to you and they are at that wit's end, they want to get back to their life? How do you guide them through the process?
A lot of times I do deal with common, simple injuries that are easily treated. These patients have had a lot of surgeries in the past. They've had issues or complications that I deal with. And we come with the expectations to help finalize what we expect from their surgery as far as how they could go about their daily activities, what we expect with their function. And as long as we meet those expectations, those patients are very happy.
It's really amazing. Well, thank you both so much for sharing your expertise and why you got into the field. We'll be right back after a short break, but before we do that, let's check in with Maura Stout, out in the field as she discusses the importance of physical therapy at St. Luke's.
Hi, my name is Maura Stout. I'm a physical therapist / hand therapist at St. Luke's Physical Therapy at the West End location in Allentown, Pennsylvania. I got to observe physical therapy in general being a profession of multiple professions, because you can be the teacher, you can be the motivator or the coach, and then with hand therapy you can be the artist and making different types of splints and being creative and being innovative, and I think that's kind of what drew me to it. So there are many differences between physical and occupational therapy, but hand therapy is where our two disciplines tend to overlap. Different diagnoses that we see hand and wrist fractures, we see tendinopathies for arthritis, carpal tunnel, trigger finger, and a whole other array of different diagnoses. With having our specific documentation system, we have very fluid communication with the physicians. Communication is flawless, and I really, really value the fact that they value our opinion on things. So when things just aren't looking right and where we want them to check something out for us, they kind of take that in consideration, and I really, really value that. It helps us to kind of have a good setup for when the patient actually does come in. So once the patient comes in to see us, we'll be doing a formal evaluation where we would take an extensive history as to the possible mechanism of injury and just kind of get that story first. And then that will direct the rest of our evaluation and tests that we may perform and measurements that we'll take. Also getting to know maybe what activities tend to bother their symptoms more, and then what activities do they need to get back to, and what are their goals for therapy, and establishing that. And that is how we develop our plan of care going forward. Hopefully patients have some sort of relief within the first few sessions. That's really our goal. And if not, then we would probably change what we're doing. I think it's really important on both sides, for the patient and for the therapist as well, to continuously reevaluate. A lot of times I kind of use the term like little victories with patients, because sometimes when your hands are debilitated, it can be really daunting for patients. So if you kind of celebrate those small victories for them and encourage them to keep working towards their goals, I think it's really important. It's probably the most rewarding thing as a therapist, is when the patients are walking out of here and they got back to exactly where their life was prior to injury, or they're at least back to where they wanted to be at the beginning.
Hi, my name is Matthew Johnson. I'm a physical therapist at St. Luke's. I work at our Sports Medicine Rehab Center in Bethlehem. This is Physical Therapy Tips from Physical Therapy at St. Luke's. Today, we'll be talking about injury prevention. Did you know that 25 to 50% of all sports injuries are preventable? There are some simple strategies that you can do to reduce your risk. One such strategy is a dynamic warm-up prior to participation in a sport. A simple example of a dynamic warm-up would be walking 5 to 10 minutes, followed by bodyweight squats and walking lunges. For youth and high school soccer, the FIFA 11 program has been shown to cut ACL injuries in half for teams that implement this as a dynamic warm-up prior to practice and games. Another important concept is proper progression. For example, a runner that increases mileage greater than 10% a week is more susceptible to an overuse injury. Following a slower progression gives our soft tissues and bones time to adapt and strengthen, thus reducing chances of injury. For youth baseball and softball, utilizing pitch counts can reduce missed playing time due to an injury. The MLB Pitch Smart program outlines these guidelines for youth athletes. Thank you for watching. If you're a part of a team or organization that would like to learn more about injury prevention, Physical Therapy at St. Luke's can help.
St. Luke's has been named a top 50 cardiovascular hospital in the country for the 8th time, and we're in good company. St. Luke's has the only local heart care team to be ranked in the top 50, along with Mayo Clinic and the University of Pennsylvania. This means our heart patients have higher survival rates, fewer readmissions, fewer complications, and better patient experiences. Using the highest quality healthcare standards, no other hospital in the region has better heart care. St. Luke's, my heart is in the right hands.
Welcome back to St. Luke's Health Now. Tonight we're discussing orthopedic care and the many advances offered at St. Luke's. We want to thank you, our viewers, for tuning into our program and for submitting your personal questions that'll be answered later in the show. Joining me are Dr. Raduca and Dr. Rami, who are experts in the orthopedic field. So let's examine some of the treatment options available. Dr. Rami, I want to start with you. What are some of the most common shoulder and elbow injuries and what causes them?
I see a lot of rotator cuff injuries, the tendons in your shoulder that can be injured. Also in the elbow, I see distal bicep tendon ruptures and tendinitis. Those are very common injuries I see, and those can come from wear and tear, a lot of times overuse injuries, many times trauma from falls, from sports-related injuries, even motor vehicle accidents. More often than not, these are very manageable to treat, and we do treat them with conservative care at first, but then if they do fail, we do have operative treatments to offer them.
It's nice to know that you can try something before surgery, perhaps, and see if that works. All right, Dr. Raduca, let me ask you this. We talked about hand problems and how integral the hands are to our everyday living. Can you talk to us about the intricacies of the hands, sort of what drew you to the field, and what you're able to do for certain common conditions that you might need to treat?
So the hand is a very delicate balance of many different bones, tendons, and ligaments, as well as nerves and arteries. Just in each finger alone is 3 bones, 3 different joints, a couple nerves and tendons, and having them all work together and function normally is key into being able to do your daily activities. The thumb in particular provides about 50% of your hand function, and it's one of the most unique things about us as humans. And just trying to evaluate each individual tendon and nerve is the most important thing in order to establish what's going on and what to do next as far as treatment options. As far as the treatment options available, kind of depends on the particular condition. Some of the conditions that I most commonly see are nerve compression, pinching of the nerve at the wrist or the elbow, such as carpal tunnel or cubital tunnel syndrome, as well as arthritic changes in the joints or cysts developing as a result of inflammation in the joints or around the tendons. And then tendinitis, around the hand as well. Most of these are overuse type injuries, but they're also traumatic in nature. You can set them off.
Yeah, really, if anything can happen with the hand, you really need that use back. Dr. Rami, you mentioned surgery. When does a patient know, when do you know that surgery is the best option? And if they need surgery, how critical is occupational and physical therapy as part of the rehab?
Obviously, if I find something that's wrong, we get advanced imaging, and if it shows something structurally wrong, I do recommend surgery. Also, if we try a course of conservative care and they've failed conservative care, then surgery is certainly indicated. So when we do surgery, we always have discussion with the patient that physical therapy is likely necessary after. This is going to help with their recovery. They're going to have a lot of swelling, inflammation, immobility, and they need to regain that motion with physical therapists. And we have a direct line with the physical therapist in communication, which is very helpful for me because I get to see how my patients are progressing, as if there's any changes that need to be done. There's prompt responses through our network that we can talk to them and make sure that they get the best care.
Dr. Raduca, I'd like to ask you the same question. When is surgery necessary, and what are some of the lifestyle things that could cause more common hand injuries?
Yeah, so like Dr. Rami was mentioning, surgery, again, in the hand, it's really a lot of failing of the non-operative treatment options. A lot of the conditions in the hand that I mentioned previously can be successfully managed non-operatively with a combination of activity modification, hand therapy, bracing, steroid injections, and things of those nature. But when those things fail to provide adequate pain relief, then surgery might be a good option for a patient. The other things that I see commonly that need surgery are structural problems, as Dr. Rami mentioned, such as displaced fractures, lacerations of tendons or nerves that are acutely disrupt function and that won't recover on their own. Doing surgery in those conditions can help restore function.
And those are often trauma-based? Those are things that maybe happen in an accident or a sports injury?
The fractures and the lacerations, yes. A lot of things that I see are crush-type injuries to the hand or fingers, as well as cutting. People cut their fingers on glass, or some other type of accident can lacerate nerves and tendons, and that would require more urgent, operative intervention.
Absolutely. And Dr. Rami, you mentioned sometimes surgical options, but often something minimally invasive is there for a patient. Can you explain to us when a minimally invasive approach is the best approach and what it really means to be minimally invasive in surgery?
Sure. So minimally invasive, typically in our field is, we do arthroscopic procedures. And arthroscopic procedures involve small stab incisions around the joint that we're going to work on. Doesn't require a big open procedure. It's very useful in our field because we are allowed to see a lot of the structures in the joint that you couldn't typically see even when in an open procedure, wide open, because you can see around the crevices, you can see all the structures, you can see specific pathology that could be causing the patient's symptoms that you may not be able to see wide open because it's advanced, it's more magnified imaging that we can see with the scope. So it's minimally invasive. You can do a lot with it. We've done rotator cuff repairs. We also done elbow scopes to help with even pediatric patients with a baseball thrower's elbow. I'll go in and I'll do it with the scope. And it's very minimally invasive. It doesn't require a big incision. And a lot of patients love that. And they do see faster recovery because the incisions are so small.
Yeah, it gets them back to their life a lot quicker. Dr. Raduca, you have a special interest in something called TMR, targeted muscle reinnervation. Is that right? Okay. When do you do this procedure and what is involved?
So targeted muscle reinnervation is basically you're rerouting nerves in an amputated extremity that can be upper or lower extremity to help with post-amputation pain in patients that develop residual limb pain or neuromas following these type of surgeries. There are a variety of reasons why patients end up with an amputation. Certain times afterwards they can continue to have significant pain in the residual limb. When those patients have this condition or this severe pain, one option is to take the nerves that are acting haywire and painful and rerouting them and sewing them into adjacent nerves going into the muscles that are left in the limb. And that can help reduce pain long term in these patients.
Which is really incredible because I think it's often a misconception that once a nerve is damaged, you no longer have use of it. But it sounds like you're able to do some rewiring sometimes to make that
Yeah, so
possible.
the main thing in this is basically trying to prevent a neuroma. So a neuroma is a condition where the nerve tries to grow after being cut during the amputation. And instead of growing normally, there's no connection that it can make. So it grows a ball of hypersensitive and tissue that will be very painful. So we resect the neuroma and sew the nerve to an adjacent nerve so that it will grow into the new nerve instead of causing a neuroma and continued pain.
Incredible. Really, such great advances. Dr. Rami, speaking of advances, we often hear about hip replacements, knee replacements, but what about shoulder replacement surgery? What's involved and when is that recommended?
Yeah, so shoulder replacement has come a long way. Just since 2003, we've had the advent of the reverse shoulder arthroplasty, FDA approved in the States since then. Significant advances since then. So what involves a shoulder replacement is you replace the ball in the socket with either metal or plastic. And what it does is it gets rid of either arthritis, which patients can have in the shoulder. It can be help for fractures that are very significantly comminuted or complex that cannot be reconstructed. A shoulder replacement would be a good indication for that as well. For the patients, the predictability of their outcome is very high. I mean, we see that patients with shoulder replacements, their pain relief is very predictable. The range of motion does become better in some cases because they're so stiff or say have an arthritic shoulder that for many years they cannot move for so long. So the tissues become stiff and everything. So then we give them a new shoulder, they're able to move it more freely with less pain. And patients love the shoulder replacement. They can see it just like their friends who have the hip and knee replacements. They can go back to sport and everything they love to do with their shoulder.
They can paint again.
They can paint, play racquetball, anything.
That's excellent. Dr. Raduca, you talked about different technologies and different modalities that might come in that you're working with, and how important is that collaboration and communication, whether it be trauma or some other department?
I think the department I work with most is hand therapists and therapy, like Maura Stout, who we heard from earlier. I work closely with her in the Allentown office, West End medical building over there. And that collaboration between hand surgeon and hand therapist, I think, is the most key to helping patients. Hand therapy is very important, following these hand injuries and hand surgeries, just for a couple of reasons. One is, you have to restore a lot of function. The hand has very intricate movements. You want each finger to try to move independently and fully. The other thing is the hand does tend to swell, following injury and surgery more than other parts of the body, just given its very robust blood supply and has a lot of healing potential because of that, but also it causes swelling and stiffness that can linger for several months after these type of injuries. So working with hand therapists to help improve function and resolve swelling is very important.
Dr. Rami, I know you have a special interest in teaching. How important is it to be passing on information to that next generation, and how important is it that we have such a big, robust graduate medical education program at St. Luke's?
Certainly, yeah. So I do have residents that rotate with me, and it's very important to impart what you've learned and what's been done in the past, because everything changes every year. We see new advances in techniques, in information, in research. But it's always good to know what's been done in the past to kind of learn what we've done. I always talk to the residents, and I teach them what I've learned through my fellowship, through my residency, and it's very satisfactory to kind of see how they take in this information, because a lot of them haven't seen this before. And they see a lot of other doctors who've done similar type of procedures that I would do, but they will see do a different way, or why we would do it for certain patients and not others. And they'll understand more, get a more robust understanding of what the shoulder elbow is about, and how we, sometimes it's not always black and white. So for me to impart my knowledge into them is very gratifying, and they reciprocate it. They love rotating with me too, I hope.
And I bet they keep you on your toes at the same
absolutely,
time.
yeah.
Well, it's great to know that this kind of technology and care is available right within our community. Speaking of, we have some questions sent in from our audience. We'll get to those right after this short break. Stay tuned.
You're determined to stay active and enjoy life. Be at your best every day with St. Luke's Orthopedic Care. Start here and we'll get you back to doing what you love. With locations throughout the region, including our new St. Luke's Orthopedic Hospital West End campus, the best place for orthopedic care is always close to home. St. Luke's Orthopedic Care. Start here, go farther.
The team that we have put together of sport performance coaches and athletic trainers is why parents should choose St. Luke's University Health Network for their sport performance needs.
St. Luke's and our coaches are going to provide the safest and most comprehensive training environment that a student athlete would want. And I don't think there's anything in this area that can rival it.
St. Luke's Pediatrics delivers everything from checkups to specialized care, all conveniently located close to home, so kids will have happy, healthy childhoods. St. Luke's Pediatrics, caring for your future.
Hi, I'm Howie Knutson, Regional Director with Physical Therapy at St. Luke's. This is Physical Therapy Tips from Physical Therapy at St. Luke's. Today, we will be talking about shoulder pain. Please be mindful of your posture. When sitting, keep your head over your shoulders and keep your shoulders back. When sleeping, lay on either your back or your side. Avoid carrying a backpack or purse over just one shoulder. Minimize working with your arms above shoulder height for very long. When possible, use a footstool or ladder to lessen the strain on your shoulders. Try not to lift heavy objects with your arms outstretched. Lift and carry objects close to your body when possible. Take regular breaks from repetitive activity. Thank you for watching. If you are a part of a team or organization that would like to learn more about injury prevention, Physical Therapy at St. Luke's can help.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. We've had an engaging conversation about orthopedic care at St. Luke's University Health Network, thanks to our amazing panelists. All right, now it's time to answer some audience questions. Are you ready?
Yes.
All right, Dr. Rami. This viewer writes, in the past few years, I've picked up the game of pickleball, like most people, and play regularly now that I'm retired. Needless to say, I now have a sore shoulder. How do I get it diagnosed, and what could be my treatment options?
Pickleball has been a sport that's really become popularized throughout the nation. And I'll be honest with you, once it's become popularized, I've seen a lot more injuries from pickleball. And the most common injury is typically like tendonitis. And usually patients come in, they're playing with short shoulder, also a sore elbow. And a lot of times I evaluate them, and most of the time it's just an overuse injury that they deal with. And it's typically inflammation. We treat it conservatively. There's other cases where I've seen pickleball players fall and they do tear the rotator cuff or they injure their elbow. And those require surgery. And when they have a traumatic tear, then I do offer them surgical intervention for a rotator cuff repair, usually arthroscopically. And I've had, I had a ranked pickleball player come to me for a rotator cuff tear, and he did great. So sounds like a fun sport. I don't play. I'm sure that a lot of people and friends have noticed injuries from this, and it's very important if you do notice that this pain is not getting better to seek out an orthopedist for evaluation.
So have fun, but maybe don't leap for every ball that comes your way. Okay. Dr. Raduca, this viewer writes, I am scheduled to have surgery for arthritis in my thumb joint. What can I expect in terms of recovery and eventual full use of my hand? You mentioned the thumb, 50%, so pretty important.
Thumb is very important. So thumb arthritis surgery is very successful for pain relief, number one. I think that's the main reason why we do it in patients that have severe pain in the base of their thumb that's not getting better with non-operative measures. So for arthritis at the base of the thumb, there's multiple types of surgeries that you can do. Most of those surgeries involve removing a small bone at the base of your thumb called your trapezium. That leaves a gap between the thumb hand bone and the rest of the wrist. The way that we prevent the thumb from collapsing into that gap varies based on the type of surgery that you do. The type of surgery that I do involves suspending the thumb hand bone to the index finger hand bone using a special button and wire device. That device allows us to start earlier range of motion, and I have patients see the hand therapist and start working on range of motion exercises 4 to 5 days following surgery and getting a custom brace made that they can wear for the first 6 weeks post-operatively. After 6 weeks, they keep advancing their activities and remove the brace and then continue strengthening for up to a year following this type of surgery. So be patient and stay the course, because most patients do end up with an excellent result and a lot of pain relief.
All right, Dr. Rami, this question's for you. I was recently involved in an accident. While I am able to move my hand, I have some trouble with mobility of my shoulder and elbow. Will this resolve on its own, or should I seek further care?
Yeah, it really depends on the severity of the accident. Usually motor vehicle accidents, you do worry. You want to be evaluated by orthopedists if it's not getting better. You want to rule out any type of obvious structural injury, such as tendon tears, ligament tears, or even fractures that can be missed. Even if you go see an urgent care specialist that doesn't necessarily see some of these that we do. So it's very important to see an orthopedist for this. Then it comes down to advanced imaging. If it's needed to be done, we'll take a look, and if it needs to be fixed, we'll do it.
Yeah, if you're having pain of any kind, I would say get it checked out, right? All right, last question, Dr. Raduca, is for you. My son has been playing basketball all through high school and now plays in college. He's jammed his fingers more times than I can count. Will these injuries and general overuse make him more prone to hand and wrist issues later in life? Great question, because you see, people who played football later need a knee replacement kind of thing. Is there a correlation between what you're doing in your youth to what happens later in life?
I think in general there can be a correlation. I was a college athlete myself, and bumps and bruises and bangs that you shake off in the moment might come back and bite you down the road, for lack of a better term. For jamming your fingers multiple times, theoretically you could have micro injuries to the joints in the finger that could put you at risk for arthritis down the road, but to my knowledge there hasn't been any research studies showing that definitively. I would say in general, minor sprains that recover quickly without any intervention shouldn't put him or her at increased risk. But the jamming a finger can sometimes be more damaging than it initially appears, and so if you're having continued swelling or pain or stiffness afterwards, you definitely get it evaluated by a hand specialist.
Well, Dr. Raduca and Dr. Rami, thank you both for being here, sharing your expertise, and it's great to know that this care is available right here at St. Luke's. For more information on orthopedic care or services offered at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-ST. Luke's. Thank you for tuning in to this special episode. We hope tonight's program leaves you feeling informed, inspired, but most importantly, empowered. I'm Ashley Russo. See you next time on St. Luke's Health Now.